What are the COVID-19 coronavirus immunity passports studied in Germany to return to normal? Antibody testing, which will reach 100,000 people by the end of April, is expected to identify those who are no longer vulnerable or contagious so they can resume their activities. The German government has had a very active response to the crisis of the new coronavirus. It has carried out the most analysis to trace the contacts of those infected, and it has one of the lowest death rates. And it also seems to want to be among the first to return to normal in a way that is safe for the population. It plans to find out how many people have developed antibodies against the cause of COVID-19 to deliver documents, for the time being nicknamed immunity passports, so that they can rejoin economic life. The study, which is in the final stages of funding, expects to have completed the first massive phase of analysis by the end of April, some 100,000 people. Those who have antibodies because they were infected, with or without symptoms, and their immune system developed them to fight the pathogen, will receive a kind of vaccination passport that allows them, for example, to be exempt from restrictions on their activities. Gerhard Kraus, a professor at the Hanover Medical School and head of the Helmholtz Center for Infection Research, in Braunschweig, told Der Spiegel. In addition to the health authorities reporting to Chancellor Angela Merkel, the Robert Koch Institute, the Virology Institute at the Charité University Hospital in Berlin and the Helmholtz Center will participate in the initiative. Germany is the European country that has done the most tests to identify the coronavirus carriers, isolate them and trace their contacts, 500,000 people per week, with the expectation of further increasing the tests to reach 200,000 per day. With 71,000 infected as of March 31st, it had 682 deaths, which is below 1%, instead of the 2% or 3% registered elsewhere. Partly that is because he has found more asymptomatic and pre-symptomatic cases. Opposition representative at the British Ministry of Health, Jonathan Ashworth, told The Guardian, "Germany appears to be leading the way in testing, and we have much to learn from its approach. On several occasions I have requested more analysis and tracking of contacts in the UK, and we would have to closely follow initiatives like this," he added regarding the immunity passport. In a column for the Wall Street Journal, WSJ, Louisiana Republican Senator Bill Cassidy, who is also a physician, proposed a similar action in the United States. To revive the economy, the government needs to establish immunity records for coronavirus. The text, which he wrote in conjunction with Christopher Maurice, a professor of public health at George Washington University who participated in Ebola control in Africa, revealed that a recent report from China found that 100% of patients were analyzed 2 weeks after that their symptoms of COVID-19 disappeared. They had antibodies against the coronavirus. They added, recovery from a known coronavirus infection or a positive antibody test probably indicates an immunity that will last at least a while. Those who prove to be immune may be allowed to return to work. The whole community is freer when the herd's immunity is achieved. That expression, which refers to the moment when the majority of the population has antibodies against a pathogen, also marks the moment when society and the economy can begin to return to normality. They gave as an example, when a nurse knows that she is immune, she can care for routine COVID-19 patients without using a mask. A bartender can serve his clients without fear of exposure. An immune insurance agent can have meetings without getting infected. There is experience in registering immunity in the United States, they added. They are currently reaching a variety of diseases that can be prevented by vaccines, and so a school can, for example, look up a student's immunization records. That, expanded to the new coronavirus, would allow a path similar to that sought by Germany.